Fat grafting is the process whereby we take fat from a patient using traditional liposuction techniques, process that fat so that it's more pure fat, and then re-inject that fat into the patient in problem areas. This can be used to correct contour deformities from other surgeries. It can be used to help correct contour deformities from a patient that's had breast reconstruction, and either from the tissue that we transplanted from one location to another location on that patient has an irregularity, or from using an expander or an implant just has a defect in an area that we'd like to improve for the patient to optimize their outcome. The process of fat grafting starts by obtaining fat. First, what we do when we obtain fat is we take an instrument like this and instill a very dilute local anesthetic solution into the fat that we're going to aspirate or remove, and that not only provides pain control during the procedure if it's done in the office, but also in the operating room as well as in the office. It helps with diminishing blood loss, bruising, and post-operative pain control. Once we have the area anesthetized, we then take a cannula such as this and hooked up to a suction machine and aspirate or suction the fat out of the area where there's an excess of fat. Once we have the fat aspirated or obtained out of the patient into our collection device, we then process the fat. And that's where the Revolve has come in terms of helping our patients with processing large volumes of fat in a short period of time. Once we process the fat, it's then ready for re-injection, and we use different types of cannulas through very small incisions to place the fat into the problem area that we want to improve. Traditionally, when we've aspirated fat, it's taken about 5 to 10 minutes, maybe even longer, for the fat to settle by gravity. When you aspirate the tissue from the body, you're not only getting fat, you also get some cells that are damaged, you get some connective tissue, which you don't want to re-inject. You also have some fluid, that fluid that we injected to anesthetize and help the patient be comfortable during the procedure as well as afterwards. We have all of that fluid that comes out as well. So when we inject the fat, what we really want to do is inject fat, not all these other materials. So traditionally what we've done is allow the fat to settle, and the fat floats, just like oil and water floats. Well, the fat floats in the fluid, and you can pour off the other fluids and then just inject the fat. But even that fat still has a lot of the debris from the cells that are injured during the aspiration process. In performing breast reconstruction, fat grafting can help address some of the challenges that we were previously faced with. For instance, when I do a reconstruction on a patient, whether I'm using their own tissue or an implant and expander than an implant, we have defects or contour irregularities, and sometimes those are in an area where it's very important, in what I like to call the public part of the breast that you can see in most women's clothing every day. And we really want that area to look as natural as possible. So fat grafting allows us to hide the upper part of the implant so that you don't see the transition between implant and chest wall. We can add a nice layer of tissue in there to mask that for the patient. If we're doing an operation such as a tram flap using the patient's own tissues to reconstruct the breast, we run into problems where we have a defect here or there, we just didn't get enough tissue into a particular area. Well, fat grafting allows us to fill that in for them and make them look very, very natural in their clothing. Besides doing fat grafting in the breast, there's all sorts of other areas where we do fat grafting. We can fat graft in the face. We do that very routinely when we're doing a facelift. We used to think that just structurally moving tissues would restore the youthful appearance in a face, but we find out more and more that as we age, we lose volume in our faces. And so in addition to lifting, we also lift and fill with fat grafting when we do our facelifts. There's other operations that we do that can help, that fat grafting can help with. For instance, sometimes you see a patient that comes to the office that has a defect from all sorts of different causes, whether it's from trauma, or maybe they've had prior surgery and now they have a contour irregularity somewhere on their body. We can oftentimes help that with fat grafting. People are even doing fat grafting to restore the youthful appearance of hands as we age, so that elderly people don't have to have such a bony appearance to their hands. We can do fat grafting into their hands. I think fat grafting has been a huge advance in terms of really doing the finishing touches, especially for our breast reconstruction patients and our facelift patients. I think it really adds a very significant dimension in terms of giving them the most natural outcome that we can, and really gives them the confidence to go about their daily activities, not thinking that people are going to notice that they've had a reconstruction or cosmetic procedure performed, but helping them to look very natural. A good candidate for fat grafting is a patient that, first of all, has a problem that can be addressed with fat grafting. Second of all, the patient really needs to have enough fat to aspirate to fill the defect. Third, of course, they need to be a good surgical risk candidate. In other words, somebody who is a good candidate to have any other type of general anesthetic or significant local anesthesia procedure in a safe manner. One of the questions that we're often asked about fat grafting is it safe? And what are the consequences of having fat grafting? Over the last 10 years or so, there's been a lot of research performed by plastic surgeons around the world on the safety of fat grafting. We looked at issues not only of can grafting these cells into the body, because not only were we putting fat cells, we're also putting cells that are called adult stem cells that go along with the fat grafting into these areas. Can that cause problems such as the development of tumors? There's other issues to ask about. If you're fat grafting into a woman's breast, can you obscure the ability for the mammographer to detect a breast cancer? And so there's been a lot of research done. All of the answers aren't completely in. We're never finally having an answer on anything in medical science. But all the data so far seems to indicate that fat grafting is a safe procedure. We haven't seen the development of new tumors, and while there is some added scar tissue in terms of doing mammography, so far it looks as if the ability to detect cancers is still very good in fat-grafted breasts. That certainly is an area that will have more ongoing research performed, but currently the American Society of Plastic Surgeons, which takes these issues very seriously, is saying that fat grafting is a safe and acceptable procedure.